Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County Television Channel 20 and the county's YouTube page. This meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracito is interpreting the press conference in Spanish, and the recording will be available on the county's website and YouTube page shortly after we conclude this press conference. I'd like to start today by recapping the events of the past month. It feels like a very long time, but on March 12th, we held the first of what has now become daily press conferences to share the most up-to-date information about the county's response to COVID-19. The first positive COVID-19 case in Santa Barbara County was reported 3 days later on March 15th. On March 19th, just 3 weeks ago, Governor Newsom issued the first statewide stay-at-home order in the country to protect the health and well-being of all Californians by creating a unified approach to state and local government efforts designed to slow the spread of COVID-19. Our local hospitals currently have sufficient staff and personal protective equipment for hospital workers and enough ventilators to meet demand right now. Santa Barbara County Public Health, each of the local hospitals, Direct Relief International, and many local businesses and individuals are working around the clock to secure more medical supplies and equipment to ensure that we can properly treat future COVID-19 patients. The county's working with local hospitals to be ready to stand up hundreds of emergency hospital rooms if needed. My board colleagues, all elected officials throughout the county, and all other local government agencies and special districts in the county are working collaboratively to stop the spread of COVID-19 in our community. The most powerful tool we have available to stop the virus is public cooperation with the stay-at-home order and simple personal hygiene practices. The consistent message that must be communicated and acted upon every day remains. Number one, stay home. Limit going out to essential trips. When you have to go out, wear a face mask or covering and stay at least 6 feet away from other people. Number two, wash your hands, don't touch your face, and continue to keep disinfecting surfaces. If you feel sick, stay home and isolate yourself in your home. Don't go out. Ask for help in getting food and medicine delivered to you. If your symptoms worsen, call your doctor or clinic and follow their medical advice. The county's public health department is working very closely with the Centers for Disease Control, the California Department of Public Health, and county public officers throughout the state of California to bring scientific and medical assistance and the best medical modeling expertise available to our county. The infection curve modeling graphs shared with the Board of Supervisors this past Tuesday were intended to illustrate how various levels of community physical distancing can change our local infection curve. The graphs, which are available at the county's website at publichealthsbc.org, show that even small changes in our collective physical distancing efforts can produce big gains in flattening the infection curve. The more we reduce new COVID-19 infections, the better prepared we are to treat new patients. If we continue to do a good job, our hospitals will have the staff and equipment necessary to save lives. If we backslide, we could once again have a very serious problem. We will determine the course ahead by our own actions. We've received many questions about how long Santa Barbara County residents will need to stay at home and practice social distancing. At this time, there is no clear answer to that question. Only Governor Newsom has authority to lift his statewide stay-at-home order. We do know we will need to continue to slow the spread of COVID-19 through physical distancing for the foreseeable future. We must continue to keep the community's full attention on the immediate public health crisis and the need to stop the virus spread. Maintaining a high level of cooperation with the stay-at-home order is critical to ending the public health crisis as soon as possible and will enable us to swiftly move toward economic recovery. Right now, too many members of our community are out of work and in need of assistance. This Sunday, the state's Employment Development Department will for the first time begin distributing unemployment insurance benefits with the additional $600 per week from the Federal Coronavirus Aid, Recovery, and Economic Security Act, otherwise called the CARES Act. The state of California is working very hard to expand staffing at the unemployment insurance call centers and reduce wait times for those who need assistance on the phone. For local information on economic recovery, please visit readysbc.org/economic recovery. I'd like to close my comments this week by highlighting the incredible work of another local nonprofit. Girls Inc. of Greater Santa Barbara exists to inspire girls to be smart, strong, and bold. Unable to provide in-person programming during this time, Girls Inc. is providing programs over Zoom for the youth they serve. Group activities and regular check-ins with the girls are taking place to provide support and maintain important connections during this stressful time. Additionally, Girls Inc. is stepping up to support our regional COVID-19 response. Girls Inc. has provided 6 vans to the Food Bank of Santa Barbara County for food delivery to seniors. These vans and support from the National Guard have allowed the food bank to increase home delivery capacity 4-fold. Girls Inc. has also opened up their parking lot to be used by Showers of Blessing, a service that provides mobile showers for people experiencing homelessness. I sincerely appreciate all the different ways local organizations are creatively using their resources to respond to this public health emergency. I'd now like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Let me give you today's results. We are reporting 17 new cases of COVID-19 today. Ages of the new cases range from the 20s to over 70 years of age. The locations of the new cases will be shared in a press release to follow and on our website at publichealthsbc.org. Of the now 260 total cases, 122 are recovering at home. 90 people have already fully recovered. 40 are hospitalized, 18 of whom in the intensive care unit. 6 cases are pending an update for our disease control team, and 2 have unfortunately passed away. Of the new cases, 6 are part of the ongoing outbreak at the federal prison in Lompoc. Our efforts to stem the outbreak are ongoing. At this time, 10 inmates are hospitalized and 2 of them are in the intensive care unit. At least 1 staff person is also hospitalized. We are working closely with the prison administration and their medical team, and we support their efforts with our resources. Many questions have been raised recently regarding newly developed test technology. In particular, new blood tests that can potentially detect antibodies against the coronavirus are currently aggressively marketed by some companies. As of today, 23 different testing devices have been approved by the FDA. Only one of these 23 is a blood test that checks for antibodies to the COVID-causing virus. Unfortunately, we do not yet have enough information at which level of antibodies a person could be considered to be immune to this disease. We are anticipating a very rapid progress in this field of study. Stanford University is at the forefront of this research, and we are anticipating results in the very near future, and it will lead to more sensitive testing modalities. I am anticipating these new tests eagerly because they will make it possible to separate persons who have had the disease from those who are at risk of contracting it. As of right now, however, please be advised that any advertisement of a do-it-yourself at-home test kit is not FDA approved and will not provide valid information due to unproven consistency and accuracy of these kits. We are currently still only testing persons who are having symptoms, and we test for presence of the virus, RNA, with the nasopharyngeal swab. Our testing capacity in the region has been increasing constantly. Cottage and Marion hospitals now have been provided the fastest turnaround test, the Abbott Now, recently approved by the FDA, which will prove valuable in making faster clinical decisions with regard to placement, care, and isolation of patients. We understand that many people are frustrated by the fact that they cannot get tested. However, we are already able to provide much more necessary lab services compared to even last week. Please be reminded, especially during these spring holidays, to continue our communal efforts of physical distancing and continue to protect yourselves and the whole community by doing so. Thank you.
Thank you, Dr. Answerk. Now we'll hear from Suzanne Grimacy from the county's Department of Behavioral Wellness.
Thank you. As the days and weeks have passed and we are now nearing a month of stay-at-home orders, for many, lives have slowed down, almost as though the eagerness of time to fly by has left. I've had the opportunity to speak with many people on their reflections. For many, there are feelings of exhaustion. Immediate preparations, which came as a novelty for most, are now in place. Stocking up on toilet paper, hand sanitizers, making lines a block long to get essential food items. We're staying at home, supporting essential workers, washing our hands and distanced by 6 feet. Now what? Focusing on the future can bring feelings of anxiety, worry, even dread for many. Wonders of knowing that we're making a difference to flatten the curve, but when will this end? It is so important to take time to remember to focus on the present. Many I have talked to have also shared newfound appreciations of the moments that pass and finding simpler things to appreciate in each day. Within our new reality of physical distancing, we now encounter our first holidays with the current safety guidelines in place. Passover has begun and Easter is to follow. This is a time to gather with friends and family, a time for fellowship. This year will look very different. This may be the first year for some to be physically distanced from family at a time that they have always been together. As you may have heard our faith leaders say, this year must look different for the safety of everyone. Celebrating apart from relatives may bring disappointment among families, even sadness. However, as we've come to see and learn, there are many ways we can still creatively celebrate and be together. I want to return to recognizing the feeling of exhaustion which many are feeling. It's normal to have feelings of worry, anxiety, stress, disappointment, sadness, even anger. And to feel that the magnitude of this virus and the impact that it's having on our lives feels out of our control. But in that, what we can do is begin to focus on what is right in front of us, the here and now, the people in our lives, what we do have control over. Enjoy this holiday weekend. Enjoy time with immediate family at home or reaching out to those that are not in your home. Enjoy having time. Take time to appreciate what we do have, not what has been lost as a result of so many changes related to the virus. Things return, lives do not. We thank our public health department, community health professionals, and hospitals for their heroic work during this time. Keep following the guidelines for washing hands regularly, staying home, and if out, maintaining a distance of 6 feet. Also, establish new routines. Move, get outdoors, and stay connected to others. The community wellness team remains available to connect to counseling resources or just a person to talk to over the phone. The team is available virtually and available countywide and can be reached by calling 805-364-2750 or by going to the website at sbccwt.org. Thank you.
Thank you, Suzanne. Now we'll go to questions in the room. Mr. Fish?
Hi, the Rite Aid in Carpinteria is now temporarily closed, and we have some video of a deep clean going on inside there, and folks in hazmat suit-like outfits going through there today, and people are talking that may be COVID-related when it comes to either a customer or staff member. Just wanted to see if you happen to have any information on that.
I do not have any information on
I
that.
don't have any information on that.
Any other questions in the room?
Unrelated question, when it comes to the new testing capabilities, you mentioned Dr. Onsorg at Marion and Cottage with the fastest test there. What is the timing in terms of the results that come back from that new testing capability?
The result of the test can be received in 15 minutes, which is really great, especially for emergency rooms, to decide very quickly where to place the patient.
And then one final, I may have just missed this number, but in terms of healthcare workers, the number for healthcare workers who have tested positive, has that changed from 37 yesterday?
No, it has remained at 37.
Thank you. Questions on the phone?
Yes. Tom Bolton with Newshawk, go ahead.
Good afternoon. I'm wondering if you could tell us a little bit more about what's being done to address the situation at the Lompoc prison. I mean, you referenced cooperation and whatnot, but what exactly is being done? Because obviously that seems to be one of the areas of greatest concern.
Yeah, I'm happy to speak to that. It is of great concern to the Public Health Department for obvious reasons. It's a very densely populated small parcel of real estate, and there are, to my knowledge, 2,700 prisoners, inmates, in 4 different areas. What they have been able to achieve is they isolated everybody who didn't need hospitalization, who is either a suspect or a confirmed case. They have a unit that can house 100 inmates in individual units where they are completely isolated, and they have plenty of staff to take care of them. They have medical staff in addition to regular staff. They are a federal institution, so they get a lot of resources by the federal government. We are in weekly discussions, at least twice a week, with their infection control and also with their emergency planning and planning on potentially even setting or being ready to set up a makeshift small hospital on their site if necessary, if their caseload would surpass the local hospital capacities. So measures are being taken very seriously, and given the resources from the federal government and also from the public health, they can be implemented very rapidly. Their staff is being tested by public health with a very quick turnaround time, and that's all I can tell you at the moment. So we are on this for sure.
Just as a follow-up, how successful do you feel they/you have been in stemming the tide of the outbreak there?
Well, there was an increase of 6 cases from yesterday. So considering the circumstances of the densely, populated prison, that is not incredibly large an increase. So having said that, it's hard. It's very hard to predict. It could change over the weekend, but I think come Monday we will have a better grasp on the spread of the virus.
And one last question on that same topic is, and I don't know if you know the answer to this, but do you know, A, if prisoners are being released as part of the normal course of the judicial process? And secondly, if prisoners being released are being checked or tested for either symptoms or exposure to the COVID?
I do not have information on that. I'm sorry.
Okay, thank you very much.
Thank you, Tom. Next, Reza with San Ynez Valley Star. Go ahead.
Hi, this question is for Greg Hart. I'm wondering what the county is doing for the local smaller cities that have been really hit hard by this, especially tourism related. Is there any programs in place, or what are you guys doing to help out small towns?
We are in regular communication with all of the city managers from the cities in the county of Santa Barbara, the elected leadership too. We have regular conference calls twice a week with all the elected officials and staff from the various local agencies. And we are doing our best to coordinate efforts to help spread the word in the communities about the public safety threat of COVID-19. We are also working with them on economic development efforts, helping them spread the word to their residents about the state and federal assistance programs that are available. We're coordinating with the food bank to expand food distribution to folks who are in need and have food insecurity. So we are collaborating at all levels with all of our partner governments in the county.
And I'm also wondering, this question is for Dr. Henning Answerk. What are the severities of the cases coming from the prison? Are they mild cold symptoms, or are they, I know that you said that there were several in the hospital and a few in the ICU, but do you have any severity levels?
All across the board. That's all I can tell you. 2 are in the intensive care unit as of yesterday. 1 could be downgraded to a regular hospital setting, no longer in the ICU, which is reassuring. But it's just like in any other community. You have milder disease and more severe disease up to the need of ventilation.
And I'm wondering, with the upcoming warm weather, if that is all at a factor to see even less cases coming through.
We are certainly hoping for that. And unfortunately, the outbreak occurred in the winter in China. So this is such a new virus that we really don't know how it responds to temperature changes or change in season, whether it's similar to influenza or not. We will find out. It's really a mystery as of right now.
Thank you so much.
Thank you, Reza.
We have no more questions on the phone.
All right, our next press conference will be held Tuesday at 4:30 p.m. Next Monday morning at 9 a.m., the Santa Barbara County Board of Supervisors will receive a COVID-19 presentation at 9 a.m., so there will be no press conference Monday afternoon, and the regular press conferences will resume Tuesday afternoon at 4:30 through Friday of next week. And the phone numbers and website addresses of the many information sources about COVID-19 will scroll on the television screen after this press conference ends. Thank you very much for joining us today.